I am one of the nurses that has been working with VNA for the last 31 years. I love my job. That's my favorite part, my home visits. So we go into quite a variety of different homes, serve a wide variety of socioeconomic levels, families with different education and different backgrounds, experiences, cultures. It's rewarding. It's very rewarding. I think all families should be able to have early intervention, not just, when there are special needs, but it really is to help the families to advocate for themselves and their children, not to just go in and do it for them, but to teach them.
I think it's an incredible experience to have families that are going through one of the most difficult times in their life. When they're not even able to really tell you what's going on, we have to kind of determine and help them to figure out what it is they need from us. And having incredible girls that work for me, Linda especially, is amazing. It's really rewarding for me to know I have a group of girls that do this.
When I first met the family, the triplets were infants. They all had developmental delays, and one was hearing impaired. Mom was there. She has an older son. I believe he was around 5 years old at the time. So at that point, she was getting ready to return back to work. We were able to sit down, kind of prioritize for her, and help her get a plan in place. Her main concern was now, as services would no longer be provided through early intervention, since they only go till the day before the third birthday, was what would come next and how would she address that?
Linda's the kind of person that doesn't just hold a parent's hand and walk them through early intervention. Her goal is to make sure that when the children leave early intervention, they can take over and they can advocate for their children. And this particular mom said to Linda, if I could say one thing about my experience in early intervention, it's that you taught me how to advocate for my children, and now I feel empowered to be able to be a mom, to raise my children with special needs, and to make sure that they get the help that they need. And she goes way above and beyond in helping them. She's amazing. She's smart. She's compassionate. She's a great nurse. She's a great nurse.
A family has to be advocate very strong for their family, to know what it is that their concerns are and be able to share this with the child study team so that appropriate accommodations can be met through preschool. And that was the case. Where initially it was determined that they would not pursue an evaluation, and Mom said she couldn't accept that, and that through her preparation through early intervention, she actually stood up for the rights of her child, and they did reconsider, the child study team reconsidered and determined, what, maybe we do need to proceed to see if she needs any special accommodations. And through that, in the evaluation process, it was determined, yes, she did. So it worked out perfectly that they started in the preschool program September, which left almost no gap from the end of early intervention to the start of the next program, and actually the next step in their life. They're doing phenomenally. They are now into preschool, and she just said, thank you so much. She said, with all of the knowledge that you provided and the preparation, I was able to move forward. I was able to make that a change, and it felt good.
When I think about the VNA, I don't think of an organization. I don't think of an institution. I think about people. Supervising a group of women that do this is amazing. To hear about their stories and have them tell me what they did for a family, and it's really rewarding. I love it.